The first child to die from the flu this year in Virginia is from our area. That word coming down today from the Virginia Department of Health. They say the child is between 5 and 12 years old. Brenna McIntosh is in the studio now with more on what parents should know.
Well, data from the VDH shows an uptick in flu activity across the Commonwealth. And as we inch closer to peak flu season, which is typically February, one doctor I spoke with says it isn't too late to get the vaccine. The Virginia Department of Health announced Thursday that a child died from the flu.
To a pediatrician, one child's death is too many. So we're all about prevention. Use your seatbelt, use a car seat, wear a bike helmet, get a flu vaccine every year.
According to the latest data from the VDH, we're seeing very high flu activity across the Commonwealth. And unsurprisingly, many of the cases they are seeing are sick children. Data shows nearly 15% of patients are 4 years old and younger. VDH investigated 7 flu outbreaks just last week, 3 of which happened in K-12 schools. Dr. Elizabeth Broderick says she's seen an increase in flu, strep, and RSV patients in her office at the Children's Clinic.
In the last, I'd say 4 weeks for us, flu has really kicked in. And the kids look so pitiful. You can tell they feel terrible.
Dr. Broderick says there are a few easy ways to protect yourself from getting the flu. First, stay vigilant in washing your hands. She also says if you're going to be in a crowded place, it's not a bad idea to mask up, especially if you're high risk. Dr. Broderick says the best protection is to get the flu vaccine.
Roll into your doctor's office or local pharmacy and get vaccines. If you're in a crowded indoor public space with flu transmission as high as it is, you might want to grab the mask out of the closet.
And Broderick says stay home if you start to show symptoms to avoid spreading the virus. Dan?
Brenna, thanks. North Carolina is also seeing an uptick in flu cases. The latest Centers for Disease Control and Prevention data marks flu activity there as very high.